Hey guys, it's been a month since I last uploaded, but postpartum life has been absolutely crazy. So we're finally getting around to talking about the whole labor and delivery process, and I have Jordan here with me because they're not kidding. Like, most of my memory of that has just been like wiped clean, and it may not be that for everybody, but for me it's definitely the case. And like, I couldn't even describe what a contraction was like. Like, I just know it hurt. So this is probably going to be my last Hollabec video. Probably forever. Like, I may still do some unlisted videos for like my friends and family, but I don't know if I'm going to be doing public videos anymore. It's too hard. And like, I want my focus to be on being a mom, and I feel like I've been pulled away from this for a while now, and now it just feels like the right time to just say like that's enough. And then also, funny enough, this is going to be my 300th video. Isn't that crazy? So it feels appropriate. So he was due April 19th, and I had gotten COVID. If you guys watched my pregnancy vlogs, you saw that I had gotten COVID during week 14, and so they were kind of monitoring it. He did absolutely fine. There was no issues during pregnancy, but the OB still didn't want me going past the 40 weeks. So we scheduled the induction for the 19th, and he was born on the 20th. So we went in at 8 o'clock on the 19th to get induced, and pretty much or at least our experience, you just bring all of your hospital bags in. You're already scheduled for the stay, so you go in, check in, and then like bring all your bags and everything inside with you, and they'll take you up to your room that you'll be in during pretty much the whole labor and delivery process. So got to the room, they had me change into my gown, and like took vitals and everything, got me hooked up to the non-stress and like the contraction monitor. And then it was probably about 9:30 that I got my first dose of Cytotec or Cetotec, I forget exactly what it's called. And so basically it's a small pill that can be taken orally, but how they usually will do it for induction is they'll insert it vaginally as close to your cervix as they can get, and that like ripens your cervix so that it will start to dilate and efface. And I remember the beginning of the process being really frustrating because it took, like, you got one of those pills every, like, was it 2 to 3 hours? They would put another pill up there.
And then after they inserted the pill, you had to sit or lay in bed for an hour.
Yeah, I couldn't move. I couldn't get up.
You could come out of position.
Right. So there was a risk of that. So I basically had to be in bed, like laying flat on my back for an hour. And then I had maybe like 2 hours after that I could get up and walk around, or like bounce on the medicine ball, or not the medicine ball, like the labor ball, and like that kind of stuff. And it took forever for me to finally start dilating. So it took like 3 or 4.
I think it was like 3 pills before
I finally hit like 2 centimeters.
Right. You had been at 1 centimeter like after the first pill.
Yeah.
And then it was like forever from there to have any progression from that point.
Yeah, it was just, it took so long, and it was pretty much just us sitting around in the room, wasting time as best as we could. It was really boring. So yeah, at that point then, it's all a bit foggy for me, but yeah, so that pretty much brought us into night. And I think I got to maybe 3 centimeters before night.
They hadn't been doing a very good job updating it. So like they weren't, when we first showed up, they were writing everything down on a whiteboard to kind of keep track for like shift change and stuff like that.
Yeah.
And they didn't update it pretty much at all throughout the day. Like they would check and give us the verbal results, and then that was it. And if you didn't remember what it was, well then, you didn't have that reminder.
Yeah. And like you get changed through, because of course you're there for a very long time, so you get changed through so many nurses, like so many times, and like doctors too. So like, oh gosh, there was one OB that I did not like him at all. Like, he was not gentle at all. Like when he was inserting the pill.
Yeah.
Yeah. Or like checking my dilation. Yeah, I didn't like him much. So yeah, so like you're going through nurses constantly, and like some of them weren't great about updating the board. Some of them were fantastic. The night nurse, oh my gosh, she was so great. So yeah, so we got through all of the 3 or 4 pills. I finally started to dilate a little bit, and we got to, it was like about 11 o'clock at night.
Well, because we had both fallen asleep around 9:10 ish.
Yeah.
And then it was pretty close to 11.
One of the night nurses.
Yeah.
One of the night nurses was really great, and she was doing different like exercises with me. Absolutely didn't have to do that, but she was so wonderful. And so she was like going through different like exercises and stretches and whatever to kind of help push labor along. So it was like after that, like one of the stretches she did was like really relaxing, and so like I was able to get to sleep after that. So yes, it was around 11. You had gotten up for something, I forget.
Well, I hadn't intended on falling asleep, so it was around 11 o'clock. I had woken up, realized I hadn't like taken care of myself at all, so I just went to use the bathroom and brush my teeth, and I was on my way back to the couch to try to get some more sleep was when you woke up and asked for the back massage.
Oh yeah.
Because your back hurt.
Yeah, because my back was starting to hurt a little bit at that point. And so, yeah, you had started to rub my back, and then I remember
like,
asking,
oh, you have to pee now.
Yeah. So I got up to go use the bathroom, and it was like as soon as I stood up, my water broke. And like it took us both off guard because it was...
We're both still half asleep.
Yeah, and like it was very much like in the movies, at least for me. It's not like that for everybody. But for me, it was like everything all at once. It was like a huge gush. Like you could hear it like hitting the floor, like whoosh. Yeah, it was a lot. And like I got scared at first. I'm like, did I just pee myself? Like I know I had to go, but I didn't think it was that bad. But it absolutely wasn't. Like one of the tricks they say is like to try and like hold it in, and if you can't hold it in, then like it's your water, not you peeing on yourself. So I'm just standing there, like my socks are soaked. I don't know what to do. And like Jordan was like so like out of sorts too. He didn't know what to do. So he ended up running out to the nurse's station. And do you want to tell that part? It's my favorite.
I just couldn't collect my words or thoughts, and I just ran out there and started screaming, "Wife, help, water." Because I couldn't really articulate anything, and surprisingly, like they didn't laugh or anything. They knew exactly what was going on, so
they knew what he was talking
run
about.
To the room, and it didn't even occur to me until after I got back to the room and kind of calmed myself down how the exchange went. And I'm like, wow, I probably sounded like a complete idiot.
No, I'm sure they're used to it. Like at that, like while he was doing that, I had waddled my way to the bathroom, and so I was just kind of hovering over the toilet, like leaking essentially. And like the nurse was super great, and she ended up cleaning up the mess I'd made on the floor. But I do know, like after my water had broke, like everything after that like picked right up, and like it started getting really intense. And like for me, like I was expecting the contractions to come in waves. It wasn't. Like it felt like for me it was like constant pain, just different levels of pain. Like there was never like a relief. Like it was just pain nonstop. And like I couldn't describe it even. Like I wouldn't know how to describe it because it wasn't like anything I've ever felt before. Like I've had some women describe it as like period pain. It's not like period pain. And like some people are like, oh, it feels like you have to like poop really bad. And it wasn't any of that.
Yeah.
Like I just wouldn't know how to even describe it.
Well, I mean, it's like eating something new and trying to describe what it tastes like. It is
right. It's
unique.
Really, yeah.
So.
Yeah. And even now, like, I don't know that I would be able to identify a contraction. Is that weird? Like, that's weird to say. Like, if I were to get pregnant again, like, I still don't think I'd be able to identify what a contraction is. It's just like, I don't know. It's the weirdest thing.
Trauma-related memory lapses.
Maybe. I don't know.
But yeah, it was, I think about 3 o'clock in the morning when you had requested the epidural.
Yeah, I had hit...
So it wasn't long after.
About 5, I hit about 5 centimeters. and like I was 75% effaced around there.
Yeah.
And it just got to be too much because like I felt like they were just back to back, because like I said, it was no, like, they weren't waves, it was just constant. And like it got to the point where like I absolutely couldn't, and like I keep telling everybody like I wasn't there to be a hero, like I just was there to get my son. So like, yeah, I had no issue at all asking for the epidural. So I ended up asking, and I feel like it took a while to get the anesthesiologist. What are they called?
Anesthesiologist.
Yeah.
You said it right.
Oh, okay. To like get him out to the room. But like in the meantime, the nurse, her name was Nurse Joy, actually.
Oh.
So Nurse Joy had recommended doing like an IV pain relief just in the meantime. So I did end up getting one of the IV pain relief medications while we were waiting for him to come up and give me the epidural. And it did help a little bit. It was at least some relief while we were waiting.
But yeah, that's definitely a job I wouldn't want.
What's that?
Anesthesiologist.
Why?
Just...
Oh, dealing with like mothers in pain.
Right. Well, I mean, dealing with anybody in pain and having to go through that process, because I mean, there's also a legal process on top of that.
Yeah. Oh, there's his bird rag.
So he had to like get verbal consent, and I'm trying to remember if he had to do like any paperwork. I don't remember there being like
no, there was. I had to sign something.
Okay.
Yeah, so I'm like in pain. I'm expected to sign this paperwork because there is like risk involved. So you have to give like your written consent that yes, I'm asking for this and I understand the risks involved.
Meanwhile, you're going through extreme contractions and having to like time out.
Well, and they were like back to back at that point too.
Yeah.
So like he was in there and he's like, of course, trying to like make conversation and crack jokes. And I was getting really mad at him. And at like one point he was like asking what name I preferred. Because he's like, Rebecca, can I call you Rebecca or do you prefer Becca? I'm like, I'm going to be honest, I really don't care right now. He's like, fair enough. So
he was just trying to keep it a light mood, though, which I know is really tough in that circumstance.
It's a dumb thing. Don't ever try to lighten the mood with a pregnant woman, like going through labor. Like, it's just dumb. So, yeah, the epidural itself actually is not too terribly bad. I mean, it's definitely uncomfortable. And you have to like sit in a certain way. Like I remember Jordan had to like support me at one point, because you have to be sitting up for it, or he made me sit up for it. I don't know if everybody does. Like I feel like
the reason being is you had to
like extend it,
open your back,
to
allow them to get the needle in. I think it was like between the vertebrae in order to.
Well, yeah, that's how they have to like go through the cartilage.
Right. So you had to like sit up and lean forward into me.
So it was like, it was a pinch, like it was like a pretty sharp pinch. It was definitely uncomfortable, but like in the moment compared to the pain that you're already going through, like it's nothing. Cause like I've had a spinal tap done before and I remember that being really painful for me. And like looking back now, it was probably the same amount of pain that I got during the spinal tap, but like in like comparison, it was just like
stomping on someone's foot as pain relief.
Right. Got a trick to take that.
Yeah, right.
So yeah, so once I got the epidural,
you went back to sleep after that.
Yeah, well, I was really tired. But I remember them telling me not to lay on one side or the other because apparently like it can affect like one side and then not the other if you do that. So you had to like lay flat on your back.
Or if you do lay on one side, it has to be like short term and then balance it out.
Right. Are you ready for more boob? So, yeah, so I got the epidural and it helped a lot, but it didn't take all of the pain away. Like it was, like it left kind of a dull, like numb kind of pain. Like, so I was still feeling the contractions, but like they were manageable. So I'm sure everybody's different. I'm sure for some people it would work fantastic. And then like for others, you know, it might not work at all. And then like for me, I was still definitely feeling pain, but it was just tolerable. Yeah, because I remember like they give you a button that you can press that releases more of the epidural medication. And like I was like pressing it constantly, like even before the 15-minute timer was up, like I was just constantly pressing it because like it wasn't 100% relieving the pain. Like I remember like some people telling me like, oh yeah, like once it's like you don't feel like anything anymore, like they'll have to tell you when to push and like whatever. And like no, like I was still feeling it. So yeah, that got me through the night, and like I was progressing pretty well. And then it was like around 8 o'clock the next morning that my OB, I was actually really lucky because it was my OB that was on call that night. So she was actually there at the hospital. And so she had come in to check on me, and I think, what was I? Like 8 centimeters dilate. Like I was really close, I feel like. Like I was really close to being at that point, but I wasn't quite there yet. So she went to go do her rounds and check on her other patients. And I remember like everybody was kind of off doing their own thing, but there was a nurse in the room like doing her stuff. And I forget what you were doing. Oh no, there wasn't a nurse at the time, because I remember asking you to go get a nurse, because he was on the phone with my sister saying that it was going to be soon because she had planned to come to the hospital to see us. And it was like, even with the epidural, it was like this instantaneous pain. Like it was so intense. Like, and then like the urge to push. So like, yeah, it was crazy how over, like, even with the epidural, like, it was just this intense pain. And I remember telling Jordan, I'm like, you have to get a nurse. Like, you have to go get somebody, because, like, this has to be it. Like, I have to push. Like, it hurts not to push. Like, you have got to get somebody. Yep. So he had to end the phone call and, like, go and get a nurse. And like the nurse came in, like I tried my best to explain to her what was going on. I'm like, I hurt, like pain, like it hurts so bad, and like I have to push, like it hurts not to push. I'm like, you have to go get my OB, like you have to get her, you have to get her now. And so they had to like go and hunt her down and get the OB in my room, and it felt like it took forever. And like I remember at one point like pleading with the nurse, like I was in tears. I'm like, please. And like finally the OB came into the room, and like she checked me, and she's like, yep, baby's head's right there, like it's time to push. And so like everybody got into position, like it was so fast, like and like they were all ready to go. And
well, I was surprised too with the bed breakdown. I don't know if you noticed that.
Oh no, like, my mind was elsewhere.
Because I thought it was just a standard hospital bed, but no, it's designed for labor and delivery. And so when it came time, like they just took that bottom part of the bed apart, and like everything is all set up for allowing them easy access to get in there. And they had like a bag with a trap and everything to allow all of the fluids and everything to escape without making a mess. So they didn't really have to like clean anything.
Yeah, he was so traumatized. Of course, I didn't see anything that was going on down there, but he said that there was so much blood.
That was the only thing that did kind of freak me out a little bit, because I mean, you see movies and stuff, nothing captures it. And I was just concerned for your well-being, because like I didn't realize there was going to be that much blood.
Oh, like, and apparently
after he was born, like there was still so much blood coming out.
Oh yeah. I mean, but that's all part of the process.
Yeah.
But like, I had asked the OB afterwards if there was like an excessive amount of blood, and she's like, no, you were normal. Like it was all normal, like normal amounts.
Yeah.
So yeah, I feel like overall the pushing process did not take long, but like my conception of time at the moment was not great.
I didn't think it took very long either, though.
No, like it felt like it took like a half hour. Like it couldn't have taken more than an hour.
I would say all total it was like maybe 15-20 minutes.
You think it was that fast?
I do.
Okay. Sorry if the frame changed. The camera stopped recording, so we had to start a new one. So yeah, so the pushing process, like I felt every contraction that I needed to push on. And it was nice too, because like the labor and delivery nurse was great. She was on one side of me, and Jordan was on the other side of me. And, like, you did great. Like, I had discussed with you beforehand that, like, I didn't want you coaching me. I didn't want you talking to me at all. Like, just stand there. Like, don't do anything. Don't tell me I'm doing a good job. Like, that's just going to make me angry. Like, don't do anything. And he didn't, and it was great.
Yeah, it was the overnight OB.
Oh, my God.
Who would not
He would not shut up. I wanted to punch him. Like, he was, like, standing in the back as, like, I don't know, a backup or whatever. And
yeah, because that was kind of the wild part. There were, 6 people in the room?
I didn't count them all. I knew there was a nurse on my side. There was Jordan on my other side. The OB was at the very end. There was the annoying guy, the annoying OB, like, behind her. That was, like, the backup OB.
Well, because they're all doing something. Like, they're all prepping the room, making sure that...
Yeah. Well, because then there was also, like, the baby nurse as well. So, yeah, there was quite a few people in the room. But, of course, I was only focused on the people surrounding me at the time. So, yeah, they were all like, just trust your body. You tell us when you're ready to push. And so that worked out really well. So, like, I'm pretty sure I'm ready to go. And they're like, all right, we're ready. And then, like, I would push. And, like Jordan said, it was, like, 2 to 3 really good pushes. Like, I remember what you said, my face was getting so red. Like, I was literally giving it everything I got.
Yep.
Because, like, I had 3 things going to my head. Like, I didn't want to be pregnant anymore. I really wanted to meet my son. And I did not want a C-section. So I'm like, this is happening. So I was literally giving it everything I got. Yeah, the annoying OB in the back. Like, every time I was pushing, like, the last one, he's like, last push, best push. Like, every single time. I seriously wanted to punch him.
Yep.
Like, he was just, it was so annoying. And then, like, oh, he kept, like, talking about my legs. Like, if you need your legs adjusted at all, like, you just let us know. Like, we'll make sure you're comfortable. And, like, it was another case where, like, it was always the men. Like, it was always the, like, the male medical practitioners that were, like, annoying the crap out of me with stupid questions. And I'm like, that's not my focus right now. Like, my legs are fine. Like,
comfort is not the focus here.
Right. Like, there's nothing that's going to be comfortable for me right now. Are you okay, baby? So, yeah, I remember while I was pushing, they had me, like, they asked, they're like, do you want to reach down and, like, feel baby?
Yeah.
And, like, I remember doing that. It was the weirdest thing. It was so, like, gross feeling.
Yeah, well, it's funny because, of course, like, I was standing next to you, so I had a different perspective.
Yeah.
And then at one point when you were taking a break, I decided to take a look.
Yeah.
And, yeah, his head was, like, right there.
Yeah. It's so weird. It's such a crazy process. So, like, towards the end, when he was, like, almost out, they basically told me that if I felt like I could keep pushing, like, after the 3, like, to do it. And I'm like, yep, let's do it. And, like, so, like, I would just push as much as I could.
Yeah.
And, like, when he was finally out, I hadn't realized it. And I remember I was, like, still pushing, and the labor and delivery nurse was like, hey, look down. I looked down, and there he was. And they, like, plopped him on my chest. I remember them asking, because I had, like, snaps on my gown, but apparently they didn't completely unhook, which I thought was so stupid. So they ended up, like, putting him up under my gown so we could do the skin to skin.
Yeah.
And yeah, that was such a crazy moment. So it was like 9 months worth of waiting and suffering, and, like, for it all to come to fruition, and like for the labor and delivery to be, like, relatively flawless. Like,
yeah, there really weren't any complications.
Yeah, there weren't any big complications. Like, and, like, overall, like, I labored for 24 hours. So, like, from the start of them inserting the pill, which was, like, at 9:30 the day before, he was born at 9:28 the following morning. So it was, like, a full 24 hours. So, like, I couldn't have asked for anything better, honestly.
Right.
So.
But, yeah, that was another one that kind of took me off guard, was as he was on his way out, like, as soon as his head cleared, of course, like, that's the stopping point of a push, and then you had to wait for, like, a minute and then start pushing again. And, like, I was a little surprised how durable babies are in that, because that did not look like, how do I phrase that? It looked like a very compromised position for him to be in, of having like that right around his neck and everything. And of course, like, she had to move the umbilical and grab him by the head and like try to help pull him out. And I'm like, that's my baby. Like, you better be careful. Like, you're pulling on him by his head. Like, that doesn't seem safe.
Yeah. But no, she does it all the time. So.
Right. And that's a thing for me, is I just had to trust the professionals to know what they're doing. And then, of course, as soon as he started crying, like, I lost it at that point.
Oh, yeah. You were crying.
Oh, I think everybody was.
I think, I was definitely crying.
And, of course, they had to suck everything out of his nose and mouth in order for him to cry, because as soon as he first came out, there was nothing.
Yeah. And then, so while we were doing skin to skin, they started, like, I didn't even, like, you don't even have to really think about the placenta. Like, they didn't, like, make me push or anything. Like, it just kind of came out. Like, I didn't feel it.
Oh, no, it didn't just come out. Like, they pulled it out by the umbilical.
Oh, okay.
They had me cut the cord, and then after that was severed, she was kind of like reaching around in there a little bit and like kind of helping guide it out. But they ended up having to pull that out by the umbilical and then work on doing the stomach compressions in order to collapse everything down.
I had, I think she said, 1 burst blood vessel. And like 1 tear on the side. So I didn't have a perineal tear, which was great, but I did have a tear on the side of my vagina that they had to sew up, which they did all of that while we were doing skin to skin. And like, obviously I still had the epidural, so like I didn't feel like anything. Like, they were doing whatever down there, and like I didn't even know.
Psyched me out, because of course with the stitches needle, it's that big like claw hook needle.
Yeah. So 3rd camera angle change because the battery died.
But no, it just kind of tripped me out, because of course they got that big needle. And obviously I'm aware of how delicate your area is, and of course, like, there's no hesitation because she knows that it's numb, so she's just doing her thing, and I'm watching it like, oh my god, like, that looks absolutely excruciating, and like, you're just along for the ride, like, no wincing or nothing.
Right. Well, right, because I'm not feeling anything.
Right.
Yeah.
And like, if I were to had to have done that, it would be like hesitation, like all day long, like, oh.
Yeah. So that was the labor part, and then like postpartum, that was probably the only like weird thing that happened that wasn't normal. Was it took probably like a full day for me to get feeling back in my left leg after the epidural. So my right leg was fine, but like my left leg was completely numb. Like, I couldn't like use it at all, pretty much. So like I couldn't hold him unless somebody like brought him to me, because like I didn't trust myself, obviously, to like get up and get him or to hold him while I was standing. Or, like, I couldn't move around with him at all.
Right.
So that was concerning. But then, like, the feeling did finally come back.
I also did end up having to yell at you, because their understanding of the situation, that you were having trouble walking and they didn't want to have any incidents while you were in the room of even trying to go use the bathroom. So they wanted me to make sure you didn't get out of the bed alone, that either I would help you or a nurse would come in and help.
Yeah.
And at one point, like, I was zonked out, and I woke up with you on your way to the bathroom. And you're like, just trust me, I know what I'm doing. And I'm like, I was told not to.
Well, the thing is like, because of my MS, that's kind of what it felt like. It's like when I had my issues, like one of my symptoms with my MS, it was like, it felt exactly like that. Was just not being able to use my legs. So like, I know that moving around and like working it to the best of your abilities is like one of the best things you can do. Is just
keep
like
the circulation going. And
well, I mean, just using it, you know. So And it was fine, and I did know what I was doing. So.
Yep, and everything worked out great.
Yep, and I never fell.
Nope.
So yeah, that was the labor and delivery process. Like, it was fairly simple, I guess, for us. I know that's not the case for everybody. So,
and even though it was simple and everything went routine, it's still a very memorable thing.
But like I said, like, I'm currently 6 weeks postpartum, and like already like so much has faded that I'm like, yeah, I could do that again. Like, I would do it again. But but the struggle right now is just like the newborn stage, and that's got me hung up. Like, ooh, maybe I don't want a second kid because like this is tough.
But I'm sure this is also going to fade as well with time, like as he gets older and a little bit more self-sufficient.
Yeah.
And then you're just like, oh, I miss him when he was a little baby, and, you know, seeing all the cute little baby things that he'd do. And
I mean,
of course,
maybe.
you remember the positive.
I don't know. Like, I get too excited when he like I got so excited when he outgrew his newborn stuff. Like, that made me happy. I'm like, yes, he's growing. Like,
well, because you want to see him grow up.
Yeah,
like, for sure.
Like, when he got into size 1 diapers, like, I was so happy. I'm like, yes.
But I mean, at the same time, you're gonna look back at some of his old newborn stuff, and you're gonna be like, oh.
I mean, yeah.
He was such a cute little newborn. No, the only other thing I think is pertinent to bring up was when he started throwing up blood.
Oh, yeah. Yeah, we can talk about that as well. So it took us off guard because I didn't even know it was a thing. I talked to my sisters who have kids. They didn't know it was a thing, but apparently it is more common than you would expect. But apparently just through like the whole vaginal delivery process, he ended up swallowing a lot of blood during that process. And of course, like, the nurse was saying, like, it can't be digested. So essentially what happens is the baby spits it back up. But like, for new parents, like, seeing your baby spit up blood, it's like a very traumatizing thing to see. And
fortunately,
the nurse was in the room
while she was working on swaddling him up.
Yeah.
And he spit up, and of course, like, I went into full panic mode.
Yeah.
And she didn't seem at all fazed by it. She's just like, oh, yep, this happens, clean it up really quick. And then tried to burp him to get him to like throw up more, which he did eventually throughout the night. Threw up quite a bit more blood.
Right.
And it was at that point when he started actually feeding better too, because prior to that it was really slow going.
Yeah. Yeah. Dude, I could do like a whole video on postpartum, but I'm not going to because it's been insane.
Right.
But yeah, so like, that's a thing that can happen, is your baby could swallow blood during the labor and delivery process, and they could throw it back up, which it will be more brown in color than like bright red. So if it's bright red, that's concerning. But like, if it's brown, then it's just like old blood from like the delivery process. So don't freak out. And obviously, I'm sure your nurses would tell you as well. So yeah, that's everything.
Yeah.
Yeah. So yeah, what a weird video to like end my whole like Hollabec journey on.
I don't know. It kind of makes sense.
I think it does too. Yeah. Because like, it started all the way back in Owasso.
Right. You're no longer a kid living wild and free anymore. Now you're a mom, and you have adult responsibilities, and don't really have a whole lot of time to
or desire
set up and stage videos, and which it was fun while it lasted.
I think so.
And like, it was a life experience.
Yeah. And I'll still probably film and put videos together, just put them as unlisted for family and friends. So if you're family or friends.
And again, as he gets older and a little bit more independent, and if you have some extra time, you might put together a video just for the fun of it.
Yeah, maybe.
But that's what it needs to be, is just for the fun of it.
Oh, it was always for the fun of it.
Yeah.
So, all right, guys. Thank you so much for watching. Thank you for coming along on my whole journey. And I guess I won't see you the next time. Bye.